Well, all morning we've been talking about skincare.
Yes.
Very excited about it, especially with the sun coming out, although you should be wearing SPF even when it's cloudy. But there are several ways to treat your skin to remove sunspots, veins, or basically just to turn back the time.
Yes. Please, let's talk about this. And joining us this morning, master esthetician Susan Cummings, to talk about some tips and solutions and everything from just the most extreme to the most simple, right?
Well, sort of simple to extreme. I like that. I like that. We'll do simple to extreme. Well, okay, so we talked about, youth. Once we hit 30, we stop making collagen, and that's when the aging process really begins. Oh yeah, it just really sucks, doesn't it? But again, so we talked about the importance of protecting radiation. Use it every day. I don't care if it's cloudy, folks. But then there are things that we can start to look at doing, but it's important to get a baseline. If you have skin cancer in your family, if you're fair, everyone should go to their dermatologist, know what they're treating. Just don't go to somebody and say, I hate these spots, let's get rid of them. You don't want to treat something when you don't know what it is.
How old should we go into the doctor and find this out?
Again, family history has a lot to do with it. It really isn't age, there's not an age to it.
I've been going since I was a kid because I have a lot of freckles, moles.
Talk to your doctor.
I've had
sometimes they'll refer you on. So let's say you've been to the doctor, you have a baseline, you know that your spots are just from too much sun, like some of us baby boomers did. What can you do about it? So, first of all, having someone that you trust, a doctor that you trust, an esthetician, someone that you can sit and have a conversation with. And don't jump into anything. Please review, make sure it's right for you. But IPL, it's very, very big. It goes after brown spots and little broken capillaries. A lot of people love it.
Is that a laser?
It's actually a light-based therapy. So, again, know who you're going to. Really important, because you got to know the good, the bad, and the ugly. If the risks outweigh the rewards, don't move forward with it.
Yeah, and people who don't know what they're talking about, like when talking to you about these things, you know everything. You can tell us how it affects the skin layer to layer. And in my experience in the past, when I've talked to people, they don't know. They're like, oh, it does this, and then, so ask the questions. Be your own journalist when you go to these situations.
Have a few conversations before you jump into anything. Then you want to stimulate those cells called fibroblasts. Fibroblasts are what make collagen. They stop working when you're 30. So I always say it, poke the bear a little bit, get them to work. And there are different lasers. There's a lot of lasers out there. A Fraxel laser, which is, I have the Fraxel Dual. It actually makes these little channels into the skin where the skin has to repair itself. Basically, at the end of the day, you want the skin to have to get up and fight for itself. It needs to repair itself. Thermage, which is a skin tightening treatment, it actually goes down to the dermal layer of the skin. That's where all those fibroblasts that are laying there dead. And it's like, okay, we're going to create this thermal heat, this injury to the skin, and you're going to work again. It works for about 4 to 6 months, and it starts to peter out and stop. But still, you're creating more collagen, so you're not losing all that collagen. Again, 2 to 4% average every year after the age of 30 that we lose.
So my grandmother did this. Okay,
Grandma.
My grandma did it.
Awesome.
And I tried it too, and it was amazing to see. My grandma, literally, she's not one. Let me tell you, she is not one for trying things. She loved it. I wish she has the pictures on her phone to show, but it really did that. Thermage really did a trick for her.
Yep. So it's little things, but again, understand what's available, understand your risk rewards, talk to your dermatologist, talk to a physician, a plastic surgeon. Again, you can run down that road of aging, and then a lot of people say, well, I'll just wait till I have to have something surgically done.
Right.
You know what? You don't have to nowadays. There's enough out there that you can do that really slows down that process.
Before we go, because I know you had that question really quickly, and we're out of time almost, but ask her
ingredients.
What should you be using
as
for
you're
what
aging?
age?
Yeah.
Well, vitamins are always important to take them internally and to use them. They fight free radicals, so a good vitamin C, vitamin E, wonderful for the anti-aging folks. Vitamin A, we know it as retinol, we know it as retin-A. It's in a lot of products.
That's vitamin A?
Vitamin A. It's over the counter, so a lot of people see it raw, retinol, pure.
Yeah.
All the way up to full strength retin-A, keeps those skin cells turning over, keeps healthy cells at the surface of the skin. they hold moisture, dead ones don't. So when your skin starts to look dull and it starts to look like it's not as fresh and it gets that crepey, those little fine lines, make sure that you add some level of vitamin A or retinol into your skin.
Under the eyes too?
Good to know.
Be careful of the eyes.
Oh.
Eyes are very, very sensitive. I go up to the orbital rim and I stop there and use a great eye cream.
Thank you so much.
It was so
Very
much fun
useful
to be
information.
here.
If anyone wants to find you, ask more questions, learn about all these wonderful things that you know, where can they find you?
Well, radiantrejuvenation.com is a great place to
take a card.
find me.
Perfect.
great.
RadiantRejuvenation.com.
Thanks for having me.
Thank you so much, Susan.
Yes,
Beautiful
yes.
person, inside and out. So much
And
information.
keeping us beautiful as well, right?
Yep, because we're not going gently.
Not going gently.
No.